In this video, we're going to show you how to do the Heimlich maneuver, also called abdominal thrusts. We'll show you what to do if the Heimlich maneuver isn't possible. Hi, I'm Dr. Haroun Zayed, an emergency physician at the Ottawa Hospital. If someone is choking and can't cough, speak, or breathe, you need to act fast. Tell someone to call 911 or call yourself if you're alone. It's important to note that the Heimlich should not be used on infants under 1 year old. First, get into position. Stand behind the person. Reach around their waist and make a fist with one hand. Place your fist just above their belly button. Cover your fist with your other hand. Next, give quick thrusts. Pull inward and upward in a sharp motion, like a J shape. Keep going until the object comes out or the person starts breathing normally. If the person is pregnant or you can't reach around their stomach, you'll use chest thrusts instead. Stand behind them and place your fist in the center of their chest, right over the breastbone. Cover your fist with your other hand. Pull straight back toward you with firm, quick thrusts. Repeat until the airway is clear or they collapse. If you start choking and there's no one around to help, you can still take action and save yourself. First, call 911. Even if you can't speak, leave the line open so the dispatcher can send help. Then, immediately start giving yourself the Heimlich. Make a fist and place it above your belly button. Grab your fist with your other hand and thrust inward and upward. Or lean over the back of a chair or the edge of a counter or table and press your upper belly into it quickly and forcefully. Choking happens fast, but knowing these steps could help you save a life, even your own. To be prepared for other emergency situations like this, check out the rest of our first aid series.